Hi everyone and welcome to my week 4 presentation. This is for the course MPA 520 and my name is Evelyn Bright. Let's get started. So first we're going to have our agenda, and with that we're going to start with our preliminary information in regards to the crisis situation that we're going to be explaining. We're going to talk about each interval of time, which is 3 minutes, 3 hours, 3 days, and then 3 weeks, and then the conclusion. So the preliminary information is that this was in regards to a terrorist attack. This is my crisis situation or crisis scenario. The one that I kind of chose was in regards to the IRC Inland Regional Center, and that was the terrorist attack in December 22nd of 2015. There were 16 deaths, 24 people were injured. The guest count or guest size was approximately 75 to 80 guests, but there were 91 people invited. Around 10:58 a.m. is when the shooting starts, and shooting was over in approximately 2 to 3 minutes, and over 100 bullets were shot during that time. So the first interval we're going to start with is a 3-minute interval, and in this crisis scenario, for an active shooter, it typically is when the shooting has stopped. There's mass chaos happening. There's numerous people injured or deceased. Multiple resources are being distributed. AMR, fire, police, hospitals are going to be notified. And there really isn't going to be a plan put into place other than the police know what they need to do. And being an officer, they already have their own plan in their head how to handle an active shooter, and this is why the self-leadership one is probably the biggest, is that they already have a plan in their head of what's going to happen, and they have the ability to remember that they have trained for this, but this is still a different situation that they're going to be encountering. So they have to sit there and remind themselves of their training and be able to effectively act on whatever they need to. And then the other leadership theory that I chose is going to be the leadership practices theory, only because I think that it's huge when it comes to trying to navigate through it. It is a transformational style theory. The critical incident methodology focuses exclusively on the personal best experiences, which means that people that have been in this understand what needs to happen, understand now how they have to handle it, and understand how to effectively lead these types of crisis situations. And so you want to have those specific people put into place so then they can effectively lead during this time when there is mass chaos, there is no direction for people, and they just don't know what to do. And so with self-leadership, a lot of officers have this, but also with the leadership practices theory, they have to realize that people are coming in with their own experiences and trying to use that to the best of the ability to be able to handle this type of situation and to be able to effectively lead through this situation, because nobody else knows what they are going to do or how to handle it, because nobody's probably been in this type of situation before. So yeah, let's go on to the next slide. The next time interval would be 3 hours. And so 3 hours into this crisis scenario, you would have the investigation starting, relief centers for people that are working this huge scene. Hospitals are jam-packed with people that are injured or possibly even deceased. You have different resources that are shutting down traffic in all directions. You have resources from AMR, police, fire, hospitals, city workers, and then all of the reactions start to set in during this 3-hour mark. Now that everything has now stopped and everything has now had a chance to breathe, this is when everything starts to panic and everybody starts to freak out. So the two leadership styles I chose would be strategic leadership, and with that being said, it is really the the way that leaders use their creative problem solving skills and vision to help the team members um, achieve the long term goal, which is obviously to get these people help and to make sure that everything is completed and finished. I do think that strategic leadership is huge and it's something that needs to happen, but sometimes it gets very difficult for people to be able to switch themselves from being involved to being able to help the people that are around them. And I think it takes a really good leader to be able to effectively do that. I do think that the transforming theory is a huge one too, because it's showing that you have the ability to motivate everybody around you and to transform yourself from one type of leadership role into another one and be able to bring forward what is needed in that moment instead of what is needed overall. I think that is huge when it comes to the different intervals and being able to effectively manage or lead this type of scene with everything that's involved with it, with the different facets, with the different agencies, trying to really establish a common ground and be able to build off of that common ground as well. During the 3-day interval of this crisis scenario, you're going to have the trauma that's flooding in from everybody that's been dealing with this for the last 3 days, of the what ifs, what we could have done better, everything that kind of entails with that. It's still all hands on deck. No matter who you are involved in this, there's all hands on deck to kind of make this still work. There's follow-up care for people that were involved during the actual shooting and people that are struggling with what could have happened or what could they have done better. The cleanup crew is now starting. The debriefs are starting within like the police department, fire department, ambulance, hospitals, and then all family notifications should be out and already completed. And the two leadership theories that I kind of chose was E-leadership and trait theory. So the first one was emotional leadership theory, which means that it's a communication theory, that it's where you're able to really communicate effectively to everybody that's involved and be able to kind of empathize and be able to relate to a lot of situations and kind of pull yourself away from what you're feeling internally to be able to help the others that are kind of going through what they're going through during this time. And it's a really good leadership skill to kind of have, to be able to communicate effectively during these types of situations. And that is probably one of the biggest things that needs to happen during this time. And then for trait theory, I chose that one only because it takes certain people to be able to have these natural skills or traits that they've kind of been able to establish within their own training or within their own knowledge to be able to effectively help people in certain time frames of their life. And certain people have certain traits that other people don't. So I think that specifically this one would be huge in regard to the 3 days, because you're dealing from different facets from all over. You're dealing with the police department doing their debriefs, the fire department having a lot of trauma from it, the police officers that were involved in the shooting to take down the suspects, they're now having to go through the process of trying to understand what just happened and not be at work and not being able to be there with everybody else that was involved. So I think it takes somebody that's very strong-willed and somebody that's able to be empathetic, understanding, and really able to pull themselves away from the situation that just occurred to be able to effectively help people around them in a better way. So during the 3-week interval for the crisis scenario, 3 weeks after terrorist attack or an active shooter, there's a big debrief typically with everybody that's involved. There's a lot of emotional trauma that comes with that, and mental awareness, the ability to have treatment for everybody involved, even families of people that were involved and friends of people that were involved. And then it's the healing of the recovery process. And so the two styles of leadership that I would say would probably be the best styles that I would personally use during this 3-week interval would be the supportive style theory, due to the fact that it's showing the concern and consideration for the needs of the people that are involved, and it creates this environment for each person that's involved to where they can come and they can kind of communicate how they feel, and they don't feel that they are being just pushed aside. They feel supported. And then the other one would be the collaborative one, which meaning that everybody is working together. There is representation, there's different networking, there's partnerships, and everybody is able to get essentially a piece of the pie, as it says in the book, and everybody's able to feed off of each other and able to grow and be able to learn and make sure that if this does happen again, that there can be a way that we can handle the situation if it needs to be a better way.